Good afternoon, everybody. You're very welcome to the third theme of our webinar of the section. I just want to thank Michael. He's a hard act to follow, and thank you all here. There's still 72 participants, so that's great to see. So our first speaker this evening is Mr. Howard Caton, and I'll just tell you a little bit about Howard. Howard is the Director of Professional and Regulatory Services in the, sorry, just got the wrong one there. Howard was appointed to the ICN Permanent Chief Executive Officer in September 2019. Previously, Howard was the ICN Director of Nursing Policy and Programmes for several years before stepping up to the CEO post. Prior to joining ICN, Mr. Caton held key roles in the United Kingdom, including at the Royal College of Nursing, and also worked extensively in Europe, the United States and New Zealand. The International Council of Nurses is a federation of more than 130 national nurses associations representing the millions of nurses worldwide. Operated by nurses and leading nurses internationally, ICN works to ensure quality care for all and sound health policies globally. And Howard, it's great to have you with us today, acknowledging and celebrating the International Year of the Nurse and Midwife.
Fiona, hi, good afternoon. It's an absolute pleasure to be with you all and to all of the senior nursing leaders from across Ireland. I bring greetings from the ICN President Annette Kennedy. The irony is you are all a lot physically closer to Annette right now than I am, but she sends her greetings, and I bring greetings from the whole of the ICN board as well. As always, hugely grateful to INMO for the phenomenal support that they provide to ICN, and I mean this most sincerely. INMO is an organisation held in really high regard globally amongst our other associations who regularly look to Ireland and look to the INMO for advice and support and guidance. I'm gonna try to share my screen with you now because I do have just a few slides. I'm hoping that you can see those slides. Am I good with the slides, Fiona?
Yes.
That's excellent. Thanks very much. So look, this is going to be a little bit of a whistle stop tour in the next 15 minutes. You all know that this year was designated International Year of the Nurse and the Midwife. First time ever WHO had done that. Yes, they wanted to bring attention to nursing and midwifery, to raise the profile, to show the potential. But I think that they also recognized that nursing was just so integral to the global health challenges which were their priorities. And you can see I've set out what the global WHO health priorities are, or what ICN priorities are as well. And in the WHO's current program of work, their 3 billion challenge, they call it, I think they recognized that they weren't going to deliver on that without the nursing and midwifery workforce. So of course, let's make it the International Year of the Midwife. Lots of celebrations and events planned, and within days, as we know, we were hit by the COVID pandemic. One of the things that ICN was able to do and continues to do, because we've got 130 national nursing associations in membership, is really to follow the course of the pandemic around the world. And there's been some phenomenal sharing and learning that we've been able to do, starting in Asia, and then as we've moved to other regions, and of course as we're seeing second surges. This, what you can see on the screen, the ICN call to action, this was a call to action which was actually put together end of March, beginning of April this year, based on those discussions with our associations about what the 12 priority areas were that globally, the nursing community believed that we needed to be focusing on. Big one of these is about the protection and support for nurses and healthcare workers, not just issues to do with PPE, but also pay and mental health as well. Issues around redeployment of staff, registration and regulatory responses, capitalising on nursing leadership and the opportunities to learn for the future. And these really have stayed as the sort of the foundations of the approach that we with our associations have taken. I said that the protection and support for nurses and healthcare workers was an issue which was clearly hugely significant right back in March and April. The problems with the supply of PPE, not just the supply and distribution, but in some places the quality, leading to concerns about infection rates amongst nurses and healthcare workers. ICN has been, through our associations, tracking and monitoring the situation globally since March. We've been updating, we're producing reports that are on our website, but I just want to spend a couple of minutes just to share with you what the latest data that we have. From around the world, there is a huge variation in terms of the infection rate, COVID infection rate amongst healthcare workers, as low as 1% in some countries, through up to 30% in other countries as well. I know that this has been of interest, and ICN has been involved with INMO in terms of some media work around what the situation is in Ireland. We think on average around the world, it's about 10% of COVID infections are healthcare workers. We were hoping that we might start to see that go down, as particularly the supplies of PPE were improving, but with these second surges, we're not seeing that translate as yet. In countries where they do collect more granular detail on infections, it's showing that nurses are, at the top or close to the top of the group of healthcare workers who are most likely to be infected. In Mexico, their data shows 48% of health worker infections are amongst nurses. If you then look at the graph, and it's already out of date from the last time that we put this together, what are we now through 50 million COVID cases globally? If the average is around 10%, then it could be up to 50 million now of infections that are amongst healthcare workers. Around 5 million out of the 50 million infections that are healthcare workers. Clearly a huge number. Significant, obviously, in terms of making sure that people are protected and then get the right support if they're unwell. But then the knock-on consequences of if that number are becoming unwell, what that means for the capacity of the current workforce, not just in the short term, but obviously the impacts of long COVID and what that will mean as we start to see second waves. Very, very tragically, I have to say that we identified nurses who had died as a result of contracting COVID. We've been tracking this around the world. In August, there were more than 1,000. We went through the 1,000 barrier. We reported just at the end of October that we now know of more than 1,500 registered nurses around the world who have died as a result of contracting coronavirus. That's just in 44 countries. So the true number will be, I'm sure, higher than that 1,500. It's the same as the number of nurses we lost in the First World War. We don't know what the fatality rate amongst healthcare workers is. What we do know is it's running at 2.5, 2.6% fatality rate amongst the general population. If the fatality rate was just 0.5%, we clearly know that nurses and healthcare workers are dying. If it was that, we could be talking 20,000 plus deaths. So another really significant number. And the reason ICN have been bringing these numbers forward to obviously to highlight the scale of the issue, to then be able to talk about what the policy response and action needs to be. But we are still not seeing countries systematically and in a standardized way collecting this data. in many ways, the countries who are collecting the data, and then we're able to do the analysis from that, I think some of them may have felt a little bit bruised in terms of bringing this data forward, but I congratulate them for doing that, because it allows us to analyze, to understand, to improve infection prevention and control measures. We've continued to lobby really, really strongly on this data point, and just in the last couple of days at the World Health Assembly happening here, well, happening virtually, we intervened and shared this data and called again for improvements in the collection of data. But it's not just the infections and the death rate, colleagues. These are the results from the most recent survey of associations around the world. Big issues in terms of compensation. 45% of associations saying that compensation is available for health workers infected, means more than half aren't. More than half of countries aren't recognizing COVID as an occupational disease, and you know better than I do the significance of that in terms of standard setting, monitoring, data analysis, compensation. But a really big issue that's also emerged globally are the mental health and psychological pressures on nursing staff. 60% of NNAs receiving reports of mental health distress amongst nurses, and interestingly, it's often the associations who are then stepping in to provide support. And this isn't just, you know, in countries which are far away. Just yesterday, there was a report that we commented on from Wales about intimidation and verbal assaults on nurses in South Wales. There's been issues as well with infection prevention control training. PPE supply overall, yes, seems to have improved, but when we dug down, still issues in care homes and long-term care facilities. All of this information, the data, the sharing, the learning, webinars available through our website. If you click on the website, there's a tab which says COVID portal. You go and you'll find this page, and you can find more information and the actions that ICN has been calling for. I'm going to move on and talk about the State of the World's nursing report. As I said, nearly all of the plans that we had for this year had to be changed at the beginning of the year, but one which didn't was the work and the production of the first ever State of the World's Nursing Report, which was launched on World Health Day on the 12th of April this year. It's a WHO report. You all know that the WHO standard for data and for research and evidence is set very high. And I think that's something really significant about this report, is that the quality of the data that we do have. Of course, there's always room for improvement, but this is a definitive picture as we have at the moment. It was put together with a ICM helped to co-chaired the report, and there were a number of key nursing organisations involved in putting this together. Very simply, colleagues, the top line messages from the report was we need to invest in education, jobs, and in nursing leadership. The report highlights that we've got nearly a 6 million shortage of nurses, and you just think about that in terms of health systems preparedness going into this pandemic, that we were 6 million down already. So it needs to be massive acceleration increase in education. Big problems and issues with the quality of work, decent work, including paid terms and conditions, and a huge issue in relation to strengthening nursing leadership throughout health systems and up to government level. I'm not going to go through all of the data, but it just to unpick the 5.9 million shortage out of a population of 27 million. There's a gross inequity in terms of the distribution of that shortage, and you can see it on this graph here. Nearly 90% of the shortage, the 5.3 million, is in low and middle income countries, and you can see the difference in densities, a tenfold difference in density between numbers of nurses per 10,000 population in Africa compared to the Americas. And we've also been saying very clearly, Europe, Americas shouldn't think that they're off the hook by this data, because they have very significant aging population issues. We've got a new report from ICN, I hope in a couple of weeks' time, that's specifically looking into the aging issue globally. This shortage, this maldistribution, obviously throws up issues in relation to international migration. That's clearly dried up in the short term because of the travel restrictions, but we're already seeing countries who are short looking to recruit from other countries. This is a report that I did with Professor Jim Buchan. It was out just a few weeks ago. It shows you, these two graphs on here, again, the great difference in terms of nurse graduates per 100,000 population in some selection of OECD countries. Ireland sits about in the middle of that. Equally, huge differences in the reliance of overseas trained nurses. At the World Health Assembly this week, the international code was reported on, countries committed to that and said they want more reporting. Clearly, we've been saying that this requires greater focus on self-sufficiency of countries. We'd actually like to see a new indicator introduced, a simple indicator that could tell you self-sufficiency, the reliance on overseas compared to homegrown nurses. I think this will continue to be a significant issue for us over the coming years. State of the World's Nursing report concludes with these 10 key action areas. I'm not going to go through all of them, they're here on the slide. But I think, ourselves, WHO, the nurse leaders and organisations who were involved in putting this together said, look, this gives us our roadmap. This gives us a roadmap of what needs to be done. We don't need to spend time now saying, oh, do we need to strengthen leadership or modernise regulation? These are the 10 key areas. Again, in the last couple of days, colleagues, the World Health Organization have agreed that the new global nursing and midwifery strategy needs to be brought to the World Health Assembly next May. So there's going to be a lot of activity now to build on those recommendations, actions from State of the World's Nursing to develop that into the next global nursing and midwifery strategy. WHO have been I think incredibly supportive and positive about nursing. They've been very visible. They've given visibility to nursing at a global level, which I think we haven't seen in recent years. Dr. Tedros appeared at the Congress of ICN last year, and this quote, one of a number of quotes that he made, but this one: any society with too few health workers is operating with one eye tied behind its back, simply cannot function the way it needs to, and I'm sure we would all agree with that, absolutely. But I think that there's there is a message beneath this as well. This slide gives you some data that you're probably familiar with in terms of what patient safety issues around the world, just the scale of safety in terms of extent and the cost implications. Potentially 1% of health expenditure on medication errors, anywhere into the billions in terms of the costs of healthcare errors. But as we all know, so many of them, 80–90% are avoidable. And this year, 17th of September, World Patient Safety Day, WHO focused on health worker safety on World Patient Safety Day. I think this was, again, it was something we'd lobbied for, but we were very pleased to see happen. We, you, INMO, I know, will talk about safety and patients and health workers as two sides of the same coin. WHO put that at the center of the day this year, but not only was it a day, they have produced a safety charter, a patient safety charter, which I'd commend you to look at because it includes specific issues of action to ensure health worker safety. Includes, for example, safe staffing levels, which we pushed hard for. And WHO is asking governments to commit to the WHO charter. I hope this will give it a real traction and momentum because it's coming from WHO. In the same way, on World Mental Health Day in October, I think it was the 7th, they focused on mental health services, again, recognizing, as we all know, the huge the increases in demand that we've seen for mental health services as a result of the pandemic. But at the time that demand is increasing, the supply is reducing, there have been disruptions to services, and you all know it's a historical, many places historical underfunding. But again, WHO bringing forward the importance of mental health services as part of this year as well. You would expect INMO to say the world's nurses need a pay rise and must be prioritised for vaccinations once one is available. But I say this because I'm sensing a mood change in some countries amongst nurses, where we're seeing unrest, dissatisfaction, disputes, demonstrations, and in some cases, strikes. And these aren't again, they're not all in faraway places. I'm talking to you from Switzerland, and we have had a week's worth of demonstrations of Swiss nurses. We've been working with the Zimbabwe Association, who've been making appeals to the High Court. Decent work conditions, fair pay, valuing economically what nurses do fairly is clearly an emerging it's a bigger issue that's emerging. And the vaccination issue, again, whilst you think it's a no-brainer that nurses need to be vaccinated, we say it because the prioritization processes that we're seeing taking place at the moment, I think unless we're diligent and keep focused on patient-facing nurses being prioritized, I think we need to do that to make sure that that happens. That's what I'm saying. Today, we've actually released something from ICN about the vaccination. The good news about a vaccination seems to be in sight. I don't know about you, I've been a bit frustrated when I've been listening to it. You'd think that our dear medical colleagues are the people who are going to deliver it, whereas in fact it's going to be nurses. We put out a strong statement today about the fact that it will overwhelmingly be nurses who deliver the mass vaccination programs, and do not kid ourselves, this is the public health equivalent of landing on the moon in terms of the scale of the job that needs to be done. And we've used that argument to also say nurse leaders need to be involved at every level, but including and up to government level, to plan and put these programs together. I'm drawing to a close. This is a slide which is it's a bit like my homework in progress in terms of the lessons and issues that we're learning through this pandemic. I've not got time to go through it all. Clearly, lack of preparedness, health systems alignment and difference between age, social care, both the strength of those sectors and in alignment, big equity issues, Black, Asian, minority, ethnic populations more diversely affected, lower socioeconomic groups, the importance of health professions to clear, concise, understandable public health messages that the public understand and respond to, political and professional leadership, the tensions between nationalism and multilateralism, and all of the issues around strengthening the health workforce. For me, from where I sit, it's reinforced absolutely the importance of WHO. There are inquiries, there's been criticism, as you know. WHO, like ICN, it's a member organisation. It does what its members say. I think that there's a very, very strong argument that WHO needs greater support, greater funding, and needs strengthening. We will get through COVID, and arguably climate change is perhaps an even more bigger threat and challenge to us than COVID. But I put this up because I think the position that nursing is in now, the prominence of nursing, the recognition of what nursing does, we need to maintain that position, that platform, to keep that seat in terms of the design of future health systems, sustainable health systems, patient-centered, people-centered health systems, more nurse-led services, more nursing leadership, investment in nursing. I think that we are in a strong position that we must maintain and perhaps make a shift change in terms of nurses having their hands on the architect's pens of future health systems design and delivery. Last slide is the founder of ICN, Ethel Bedford Fenwick. I know it's Florence's 200th anniversary, but this is a quote from Florence, and it just struck me because we've heard everybody in the WHO DG talk about solidarity, solidarity, solidarity. By union alone can the necessary strength be found. Ethel said back in 1901, 2, 3 or something like that. And I think nursing genuinely around the world, through our profession, through our associations, through all of the key different parts of our profession, are walking the talk in terms of solidarity. As I said, please do check out on our website much more details. Sorry that it felt a little bit whistle stop, but yes, I'm just over the 20 minutes. Thank you very much. Back to you, Fiona.
Thank you very much for that, Howard. I loved your last quote on Ethel and the union, and I suppose it feels as though the ICN and the World Health Organization, along with the INMO, have our backs, and that's nice to feel as a nurse, I must say. And I look forward to reading those two documents to give us a greater sense of that. So I wish you all the best, Howard.
Thank you very much.
Thank you so much.
Thank you. Bye-bye, everybody. Bye-bye.